Hello, everybody. Welcome to tonight's live. I feel like this is my intro now. Whenever I start a live, I say it like that. But welcome. It's nice to be back. Today, we are joined by a clinical psychologist. Her name is Tamaryn, and we will be speaking about fertility and infertility. June is World Infertility Awareness Month, yes. And so we will just be learning a little more about the fertility journey, infertility, taking care of ourselves, and then towards the end we'll speak about people who are trying to have babies. So I see Tammy has joined, and I'm just going to accept, and then we'll get started.
Hello.
Good evening. How are you?
I'm good. So formal. Good evening, Miss Tamaryn. How are you doing?
I'm great. I am absolutely excited about this topic tonight. It brings a lot of joy to my heart. So
I'm
thank
so
you.
glad. Thank you for coming. So I wrote a short bio, just so everyone knows who's joining us. So we are joined by Tamaryn, who's a dedicated clinical psychologist, and Tamaryn also works extensively in the fertility space, which is why I think we are having this conversation. Tamaryn's very passionate about not only mental health, but also fertility. And together we will be discussing the multifaceted topic of infertility, its impact on mental health, and then how we can better support those on their infertility or fertility journey. So welcome to you, Tamaryn. I think first things first, maybe we can start with you sharing why you do the work that you do, especially because it's two different fields. You know, there's the psychology and there's the infertility or the fertility. Why do you do them, and how did you end up doing both of them?
So I fell into both of them.
Okay.
So psychology, I always wanted to do physiotherapy, and what do you call it? Something happened to my test results when applying for university, and I said, well, give me something to do for a year. And they gave
Yeah.
me psychology, and I fell in love with psychology. So that's how psychology happened. And then fertility happened, and yeah, I also fell into that. It was through my own infertility journey and through the struggles in my personal journey that I found that there aren't many people who provide support and services in South Africa. So SASREG is an accredited body,
Mm.
and they're trying to streamline, fertility treatment. And yeah, they accrediting practitioners, doctors, nurses, psychologists, so that you have people that you know that are trained and know about the topic. A lot of people, I was quite, how can I say, I was hesitant. I didn't want to join the fertility space because I thought it's so personal,
Mm.
And many people said, but who is the best person to help you through your fertility journey?
Mm.
And a lot of
Mm.
people said it would be somebody who's gone through the journey themselves. And so I find myself here today. And really, it's hard, but I quite enjoy the work that I do. And if I can um, create awareness around infertility, then I think I've done my job.
Yes. So how, like you just mentioned that it has to be someone who's gone through the journey. Is it easy for you to separate yourself as a professional and as someone who's been through it or who's going through it? Does it just increase the level of empathy, or how do you do the two?
So I think it's quite hard. You need to physically take off the one hat.
Mm.
And so when, you go for your fertility treatment, you are a patient. I'm really good at being a patient. I think my family will agree with me. Taking off that professional hat is very easy. Um,
Yes.
but then, there are times when, yeah, when it is difficult, when a patient is sitting with hurt, and I think it's through your own personal therapy. I always believe that every good psychologist is in their own therapy process as well, because, we are human beings. Things are going to spill over. So it's, knowing what is your stuff and what you bring into the relationship with your patient, and what they're bringing in, and when is it useful and when is it harmful.
Yeah. Okay, no problem. So I read there's a certain stat that I saw on the World Health Organization website where they say infertility affects about 10 to 15 couples globally. And I thought it's so weird that the things that affect so many people are the things that are so stigmatized, and the things that no one wants to speak about, and the things that we need to create safe spaces for. I don't know if you want to reflect on this before we get into defining what infertility is and the stigmas.
Absolutely. So, what people only talk about their success journeys. So a lot of people, if you look at the research and if you sit and talk to people in the fertility space, is people keep it very hush until they have a success story. And for me, that is heartbreaking, because how do we learn? When I started my journey, I didn't know where to go. It was quite a lonely road. My family didn't know much about infertility. My partner tried to understand, but nobody really knew. And I was just very lucky that I had a therapist who went through her own fertility journey, and she really guided me through the process. So I feel like you need a village to go through in fertility treatment. And for me, it was just, it's really sad that we only talk about the success stories, and we need to talk about the struggles so that we can help more men and women who are going through fertility, so that they don't feel so alone, and so that they have the support and just the resources. There's so many resources out there that not a lot of people know about. And so if we don't have these difficult conversations, people don't know.
Do you think it's hard to speak about the struggle stories because we attach, and I think there's a part where we're going to speak about the cultural expectations, but because we attach our womanhood and our manhood to being able to have kids, so then it's hard for people to talk about it because maybe they feel like they're not good enough because they are unable to conceive.
Oh, absolutely. I mean, somebody even said to me, a colleague said to me, so what is your worth as a woman if you can't bear children? And yeah, so that was something that I had to grapple with. And I unpacked it. And biologically, yes, we were made to reproduce, men and women. But we must also be considerate of the fact that we live very abnormal lifestyles. In that,
Yes.
we pump so many things into our system that's not healthy and good for ourselves. And then also we need to think about, people are studying, people are having children later in life, people are getting married later in life, and we were meant to have children earlier in life. So there are those difficulties as well. We need to take those variables into consideration as well when we think about fertility.
Okay, understood, and I agree. So how would you define infertility? What does it mean? It sounds like such a painful term to use, but what does infertility mean? And then also just to pair it with what is the prevalence? Because I know usually we think only women can struggle with infertility, but not a lot of the times do we hear about the men's part of it.
Oh, absolutely. So infertility is a medical condition, and it's characterized by the inability to conceive with for about a year with regular intercourse. And for women over 35, because then we become geriatrics, as my fertility specialist would like to say, the period is reduced to 6 months. So if you've been trying for 6 months and you aren't conceiving, then you'd be diagnosed. So infertility, I think what is important, can result from issues from both male and female reproductive systems. And so when you spoke about prevalence, I was like, oh my goodness, where am I going to find the stats? What do you call it? South African stats.
Yes.
You know, so no, there are about, they say about 40 to 50% of cases are attributed to male factors. So it's about, give or take, it's about equal.
Yeah.
Yeah. And like you said, I think you already said that, you know, about 10 to 15% of couples struggle with infertility. That's a huge number of people.
It is. So I know you mentioned our lifestyles and our ages, but are there other factors that can cause infertility outside of the way we live, or maybe even to unpack how my lifestyle could affect my fertility? Is it the type of food that I eat?
So the biggest thing for me that I learned, and nobody told me this, is plastic. Plastic attacks your reproductive system. And there's a special chemical compound called phthalates. And in my mind, that's a swear word. So phthalates is a chemical in the plastic, and that causes that attacks your reproductive system. And the difficulty is it's in almost everything. It's in our cosmetics. It is our water pipes. You know that yes. You know, so. When I started my journey, my patient gave me this book. My therapist gave me this book to read. It's called It Starts with the Egg. And the big thing there is around lifestyle and how can we practically help ourselves through infertility. So it's regaining control over your journey. And the biggest thing I can say is cutting out plastics. And everybody thought I was quite bizarre because I just one day chucked everything out. And now I read the labels of everything. If it doesn't say phthalate free, then I assume that it has got phthalates in it. Okay, we also have to be realistic. Bless you.
Thank you.
We also have to be very, very realistic in that we cannot cut out plastics completely, right? So it's about minimizing the plastics that we put into our bodies. And not all plastics are harmful, but we know BPA, we know lead is, also harmful, but phthalates is what attacks our reproductive systems.
So if you would give me, if you could give me an example of one product that has those plastics, like you said, cosmetics, practically, what is it? Is it roll-on? Is it Vaseline? Oh, it can't be Vaseline.
Oh, yes. So I'll use beeswax now. Yes. So petroleum, yes, jelly does have.
What is the link, though, between the outside of my skin? Because we don't consume these things.
So, I mean, what do you call it? Remember, the skin penetrates and absorbs what we put onto it.
Yeah.
You know, and so it goes into our body.
Wow.
And that's the scary part. So, I mean, yes. So Vaseline, most of your products that like moisturize your skin, you know, like your shower cream, for instance, you know, you get shower washes. Woolies has also become my new best friend. Because they've got phthalate-free products, but most places are going more natural, and so, you know, on the labels they will say phthalate-free, which is very useful. But it's all about informing yourself, and really taking control, and being curious about what you're putting into your body.
I wouldn't have thought that it could be in and on. I would have thought you would say smoking, drinking, the pizza that I was having just now, the usual, but I didn't think that it can be things like that, which I think also makes me realize how much we need to be educated and educate ourselves about these things, because I don't
Yeah,
think,
yeah,
yeah, yeah.
absolutely. I mean, I can tell you about all the medical stuff. I'm not a doctor, but I can
Mm,
tell you what I know about the medical stuff. But I think what I would, when you asked me to do this talk, I was like, okay, what did I want to know that people didn't tell me, you know?
yes.
Um, and yeah, so like low vitamin D levels, we don't realize how important vitamin D is, and vitamin D deficiency is so common. So,
Wow.
as a psychologist and working in psychiatry, part of our workup is to look at blood levels,
Mm,
so we rule out certain things like iron deficiencies, and vitamin D deficiencies and hormone imbalances, because that causes, what do you call it, causes depression. But those are also
mm,
things that are so vital in fertility.
mm,
Folate, not having enough folic acid is very important as well. So it's just, like little basic things that we don't take note of: getting enough
mm.
iron, getting enough vitamin D, getting enough sleep. There's also, I don't know what we can call it. I don't know if it's a hormone, but DHEA is also that
Mm.
you can test through the blood. And yeah, it's part of your blood workup. And so there's a lot of things that can hinder, shall I say, your fertility process. So yes, we can have, for female infertility, we can have medical conditions like your ovulation disorders. You can have tubal infertility, where the fallopian tubes are blocked.
Mm,
Endometriosis, uh, age,
mm,
age is definitely a factor, because all your good eggs go first. I don't know if people know that your good eggs go first. And from the time that you are born with a certain number of eggs. And as soon as you start your period, so those girls that are, I don't know, fortunate or unfortunate, to get their period very early in life, um, their eggs will go quicker, if that makes sense.
oh,
So my mom can't quite tell me which year, but I think I was 9 when I started. So yeah, by the time I was in my late 20s,
mm,
my doctor had said, we need to freeze your eggs. And I couldn't understand why until we did a test in my 30s. And in my early 30s, my doctor said, your reproductive age is 42. And I was like, but how? And I didn't even know that
mm.
you have a reproductive age. So that's one of the things to look at and to know, as well, is if you've started earlier, it's more likely that your good eggs are going to go first, and you only have so many. Your body can't reproduce more.
Oh my word. That is scary. Okay, we'll speak about eggs um in the later. Actually, no, actually maybe let us speak about that actually. And then we'll just go back to the cultural stuff because we're already there. So we've already spoken about the effects, what can impact. What does physical wellness look like before the fertility process? Like maybe for someone who's young, like you said, they maybe not, they might not be thinking of having kids, but they should already be taking care of themselves. You've already mentioned diet and sleep. Is there anything else? And then what does it look like during the process of fertility?
So you're talking about preserving fertility.
Yes.
Okay. So my, what do you call it? My fertility specialist says, starting to preserve fertility is the day that you start your menstrual cycles. And that's scary. We need to have more psychoeducation around fertility, so that we can start, what do you call it, preparing the young ladies for fertility. So, in terms of preserving fertility, we need to take proactive measures to protect and extend our ability to conceive, right? Because we don't know what the future holds. We don't know, where we're going to be. If life had gone my way, I would have had both my kids by the age of 30, and I would have been married and all of that. I was still studying. So there was no way that that was going to happen. So it is specifically important to think about preserving fertility if you've got what's the word? Sorry, pre-existing medical conditions, So this is especially important for people that are facing medical treatments, such as, people going through chemo treatment. Radiation also affects fertility. We also have to think about lifestyle choices. So lifestyle choices in terms of smoking, alcohol, how much stress do we put our bodies through? What kind of environmental factors, like nutrition, exercise, weight management, very, very important. And when we talk about exercise, what I found quite interesting is the strength training was more important than the cardio. They're like, yes, you can be fit, but you need to actually be strong. And it didn't make sense to me until I actually had to go and retrieve some eggs, And a lot of people said, oh, it was painful and it was horrible, and there was blood. I went home. My mom and I went out for tea and cake, and we watched a movie, and I was sitting with pain tablets ready, for the pain, and absolutely nothing. But because I was fit and strong. So really, it's important to make sure that you're as healthy as you can be. Autoimmune diseases, people do struggle if they have autoimmune diseases. And remember, infertility is unfortunately genetic as well. And so that's also important to know what your family history is. And sometimes people aren't open enough to share that. And that's why we need to talk about it. And then we have like age-related factors. So I always say to all my professional women, if you aren't planning on having children now, or you aren't planning on getting married now, you're not ready now, but you do want children, just freeze your eggs. Have your pot of gold. So they call it social freezing, has become sort of something that professional women do nowadays, and that's freezing the eggs. You also get something, and I'm not too familiar with it, but you get ovarian tissue freezing. And this is where your ovarian tissue is frozen and then reimplanted later. For men can go for sperm freezing as well. But I think what's important for men is that for women, it's safer to freeze their eggs, and then they can be defrosted and used. They'll still retain their quality. I'm oversimplifying it right now.
Yeah.
But for men, what I didn't know was that when you freeze the sperm and you like defrost them and use them, 50% of them die off. So you actually want fresh sperm. So for men, it becomes actually more complex than for women. Like we can at least put our little pot of gold aside. For men, it's a little bit more tricky.
So when we put ours aside, the quality remains, and then the men's ones, it's tricky. Or is it still, there's a chance of my eggs staying there for 10 years and they might not be as good as they were 10 years ago.
No. So your eggs will be fine. Your eggs will
Okay.
be fine. With the sperm, we lose 50%, is my
Sure.
understanding.
Yeah, that's a lot.
And that's why we want fresh sperm, rather than sperm that has been frozen. But we have to hold in mind that sometimes, like for instance, if men get diagnosed with cancer, before they start their treatment, the doctor might say, well, let's freeze some sperm in case there is some damage, so that you still get good quality sperm.
Okay, so if you would simplify or explain to someone who doesn't get it, what does it mean to freeze eggs and what is sperm banking? Like, what happens? Do I pee? Do I go to the doctor and I pee and then they take it out from my, like, what does it mean? And also, is it free or do I pay for it?
Whew. So here's where it gets oh gosh, you're asking the tricky questions now. So it's very expensive. It's very expensive. And I must say the medical aids are coming on board. When I, even before I was diagnosed, because of my age, my medical aid did put me on an ART. It's assisted reproductive therapy benefit. And so I could do some of it, or most of it was covered by the medical aid. It's about 60 hours of your life, right? So we say 60 hours, but it's actually what you want to do is the ideal is to improve your egg quality. So eggs take 3 months to mature. So every 3 months, you'd have your eggs from 3 months ago. So I took 6 months. I took the paranoid approach and I said, okay, I'm going to take 6 months to get like really good eggs, because my doctor was like, oh, we're only aiming for 4 eggs.
Yeah.
I was like, what am I going to do with 4 eggs? Some people get like 30 eggs and then they still don't have embryos. So it's about like detoxing and really getting your body ready. And that means diet, exercise, and then also looking at your stress levels. But the medical procedures involve taking injections for about a period of 2 weeks. You inject yourself at the same time every day. It's very time consuming, and it must be at the same time every day. And then you do a few scans every couple of days. And then when the follicles, because the follicles hold the eggs, when the follicles are big enough, then the doctor will trigger you. They give you more injections, trigger shots, and then 36 hours after your trigger shot, you go and they do the retrieval of the eggs. So then they open up and like extract the eggs, and then they check the quality of the eggs and they see how much they can freeze and what they can't freeze. So it's quite an intensive, and it can be quite invasive for women. So that's the woman's part. The men, you need to put sperm in a cup, and
sounds easy.
Well, I thought so too, right?
Yeah. That's the stigma.
Quite.
Yes.
So that's the perception, the misconception that we have, that it's easy. But if you suffer from anxiety, some men don't masturbate, so it is difficult, And so for men, you need to put sperm in a cup. But what they have now is they have special condoms that you can use, very pricey, obviously. And you can have sex the traditional way and then put the condom in the cup. But it has to get to the lab within an hour.
Oh,
if
my
you're doing
gosh.
it at home, or you can do it at the clinic.
Oh my goodness.
I feel like I've given you nightmares now.
I know, I was never ready for this one. That is, but I mean, we see it in the movies here and there where it's a little awkward and the wife is like, it's time, and they're rushing because it's that time of the month. It's just, but it sounds like there's someone here who says, yo, for real. It sounds, and you said it's expensive, so it's mentally taxing. it's expensive, it's painful because you're injecting yourself, and emotionally also. Yes,
The injecting is the easiest part. I'm scared of needles, right? I'm
yes.
really terrified of needles, but it was so some people get a pre-mixed injection where you just inject yourself. I had to
Mm.
mix my injection. So that was the most stressful part for me was getting the mixing the medication because my doctor was like, you know, you're geriatric, and so we're going to give you the highest dosage,
Mm.
you know, your best
Mm.
choice. And we don't
Mm.
want to do this 100 times. We just want to do it once. And so I had to mix the medication, and you know, then you don't open the bottle properly, and you've got blood
Mm.
everywhere.
Ooh.
It, okay, I'm being a little bit over dramatic, and I'm fortunate to have a nurse at work,
Yes.
and she gave me my first few injections, and it was really sore. And then I said to her, let me try. And actually, it was so liberating to do it myself. And so since then, I was like, you mix the medication and I will inject, you know.
Mm.
And the
Mm.
fertility clinics are really great in that they do help you through that process. But yes, it feels like a full-time job.
Mm. I can imagine. And I know when we spoke, when we met, you spoke about how they can be egg donors. And I was like, I should have done it. And then you said it's a painful process. Now I'm imagining, because obviously when you're almost said sperm donor, egg donor, do you always get paid or do people sometimes do it for free?
So we don't like to say
Hey,
that people get paid. You get
yes.
compensated for your time.
Mm.
Yeah. So you get compensated for your time because it is a very laborious process in terms of the egg donor. So egg donors are for women that don't have good quality eggs or don't have aren't producing enough eggs.
Mm.
And sometimes the eggs are just not compatible with their partner's sperm. And then they get an egg donor, which is usually a young student. And they also go through like a screening process. So what I do is I do the psychological screening just to see that there are no like personality pathology or any craziness. You know, you don't want to give somebody else um, a nightmare. Um, but yeah, so they do go through a screening process,
Mm.
and then the egg donor will go through the egg harvesting. So they'll also have to take injections and you know go through the whole harvesting process.
How long would you say, or did you say there's different types? You took the 6 month options, so do you get to choose, or does the doctor tell you how long it should take?
So so I think if I remember correctly, sperm takes 2 months to mature, and
Mm.
eggs take 3 months to mature. That is if you want to improve the quality of your eggs. So if the doctor puts you on like medication to improve the quality of your eggs or to get your uterus ready or whatever it may be, normally then they'll give you like a 3 month process or whatnot. But it takes
Mm.
3 months for your eggs to mature and 2 months for sperm to mature. And yeah, so, but the whole process for just a harvesting eggs, just taking the eggs out, is around about 60 hours. So it's about 2 weeks of your life.
What does that mean? Does that mean it's taken out? Like, what does 60 hours mean? I'm trying to make it
Oh,
practical.
okay. So you'll go for your initial, they'll do a blood workup
Okay.
and they'll see, you know, do you have enough vitamin D, folate, DHEA, or whatever it is? You know, do you have eggs? Let's
Mm.
start there, you know.
Mm. Mm.
Are you producing follicles naturally? And according to those results, the doctor will know which injections to give you. And then they'll send you home with injections for about a week, and you'll inject yourself at the same time every day. And then you'll go
Mm.
for a scan, and they'll do a scan to see how far the follicles have grown. If they're not big enough, doctor sends you home for a few more days with
Mm.
some more injections. And they do that until the follicles are big enough, but then it's time limited. because we don't want to lose any follicles, because they can also, like, they die off. Die off's not the right word, but you can lose a few follicles if you don't do it at the exact time. So when the follicles are ready, and you can have lots of follicles, but some of those follicles can be empty, so it doesn't guarantee that there are eggs in those follicles. But when the follicles are ready, they give you a trigger shot, and then 36 hours later, you'll go into the clinic, you'll get an anesthetic, and it's a really painless procedure where they extract the eggs out of the follicles.
Sure. Okay, so you mentioned that it's an expensive process, right? Does this mean it's not available at government or public institutions? And also, does this mean that if I can't afford, I almost said it's like mental health care, but I can't say that with you.
Of course you can. Of course you can. Absolutely.
I'm not gonna say it out of respect for your work. But so it's basically like a premium thing where if I can't afford, I basically can't go through this process because I need to have a lot of money.
Absolutely. And you know what? The doctor can't tell you how much it's going to be. They give you a quote, and it's very likely that, that's not going to be what you pay. So people do go into large amounts of debt to afford this. So that's why I said it's great that the medical aids have come aboard. Some medical aids have, but it's only really the premium plans. So your middle class people do really struggle. Never mind people who are less fortunate. Yes, they can try and give medication, and they can prescribe certain ways. But yes, it's not accessible to everybody, and that's the difficult part of this.
Yeah, that's sad. Okay, I'm gonna move on because I think this takes us nicely into the whole mental health and infertility topic. So maybe as a professional who works with people and also someone who's been through the process, what would you say is the emotional toll of infertility? Like, how does it affect? And what is it that affects one? Is it the process? What is it exactly?
Okay, so when we look at addressing the emotional toll of infertility, right, we need to look at a holistic approach, right? Because it's emotional, right? There's an emotional aspect, so you need emotional support. It is a medical condition, so you need medical treatment. And then you need coping strategies that are tailored to the individual or to the couple. And yes, there is so much that goes on. It is actually really scary how profound the emotional toll is on couples and individuals, So we have the normal things, the stress and anxiety due to the uncertainty and the stress related to the treatment. You have feelings of depression. So a lot of our women have to go on to antidepressants during this process. And that's just so that we can try and make this process as easy as possible in terms of you don't want to, because remember, people often think about bonding with the child when the child is in the world, but the child's already in the world once the embryo is formed. So once we implant that, that embryo, and the embryo takes, that's when the bonding starts. So the first thing I ask anybody that steps into my office is, how were you conceived? How did your parents feel? What was the pregnancy like? Because that tells me about your personality and your attachment style and how we will work in the relationship. So that's very important, is to help mom bond from day one. And obviously, because it's such a strenuous process, you have feelings of hopelessness. There's times when you just want to give up, There's feelings of loss as well, There's loss and grief. And I often help the couples, and I'm privileged to see men and women with infertility. And it's so important to address the miscarriages. It's so important to acknowledge that you are a mom, and a dad, even though you don't have a live child. So in South Africa, I don't know about other countries, but they don't acknowledge the child unless it's a live birth. And for me, that is like, yeah, it's just a personal thing. It's like, but your body went through pregnancy, and it's so hard, to think about, what do you call it, having another child if you haven't grieved your child, the children that you've lost. So I often help my ladies and my gents grieve the children that are not with them, because there are moms and there are dads. Because as soon as you conceive, you have a different way of thinking. Your body's doing different things. You already start parenting together. And so, when you lose a child, there's that intense loss. And so you have to go through the different stages of grief. There's also anger and frustration, um, I'm very ashamed to say this, but we often fight with our fertility specialist, and I say shame, when we walk out of there, we're like, sure, he still keeps us, but yes, there's a lot of frustration because of unfulfilled expectations, you want to become a parent, and it can lead to a lot of anger and frustration. And then misplaced blame. Couples may direct their frustration to each other, which leads to conflict and causes a lot of strain on the relationship. Other feelings is that of guilt and shame that you're struggling, because as a woman or as a man, you're supposed to reproduce, and you start to blame yourself for these things. Also, there's a lot of stigma in society. And cultural norms that may lead to the feelings of guilt and shame and inadequacy, So often this is a very lonely and isolating process. And so people withdraw socially until they have their success story. It has a huge impact on relationships, because people who haven't gone through fertility don't understand the strain that it has on your body, that it has on your partner, and then also it can cause a lot of tension in the extended family. We also talk about jealousy and envy. There was a time where I couldn't go into woods and see a pregnant woman. If I saw a pregnant woman, I'd park the trolley, put the basket down, and I'd walk out. And it's really hard to be happy for people when you see your peers or your colleagues. I mean, during my fertility journey, 2 of my colleagues in my office fell pregnant, one after the other. And it was so difficult while I was doing the harvesting. And I mean, that's just normal, you want to be happy for them. So you feel very conflicted. Like, how are you happy, and how do you almost begrudge them, and so those are normal feelings and conflicting feelings, but they can all live together. Identity and self-worth. So sometimes, we feel like we aren't complete as women or as men if we cannot reproduce. So you have a sense of loss of purpose. And then also, I think you mentioned it right at the beginning, is masculinity and femininity. That infertility can challenge, those traditional notions of masculinity and femininity. And it affects how you perceive yourself. Sometimes women actually become quite detached from their body and actually, don't love their body as much as they should, or look after it as they should. And some people can actually self-harm in different ways.
Sure. So you've mentioned all these things, and I'm sitting here picturing myself now as this person who's trying to have a baby. I need to be in my most healthiest state. But there's all these things that are happening in my head, in my heart, in my body. At the same time, I'm trying to be healthy, but I'm going through all these thoughts, and it just sounds like such a conflicting experience. I can't imagine. I mean, when I was pregnant, many years ago, I thought the most important thing for me was to not stress because that's what you're told. Don't stress because it's going to affect the baby. But the baby's already there. So I'm at least protecting something that's there. But I'm just trying to imagine what it's like to try and create that form of life on top of all these other things, financial, emotional, spiritual, because if you're spiritual, you're fighting with whatever it is that you believe in. Oh my goodness, it sounds like a lot.
So I think, like, my mom keeps reminding me of this, and she says, do whatever you need to do for you. And if that means shutting out the world, that's what it means. So what was lovely is, you start feeling the follicles grow, you start feeling movement, in your belly and things like that. And it's taking the time to, you get swollen. Everything is swollen. I don't know if you felt it, but like everything is swollen and everything feels gross. But just knowing that you're trying to make a human being, or keep a human being alive, and incubating that little precious girl or baby, is just, I think just taking that time out to just enjoy it, is so beautiful. So every night I'd feel all gross and icky, and I'd have my cup of tea and I'd lie on the bed, and I'd just bond with my belly. And that helped me through the process, to like end my day, and starting the days that, yeah, sometimes you're going to, feel really icky and gross, throughout the day, and you struggle. But I mean, I was fortunate. I can manage my workload according to what my life looks like, in some ways, right? Is that I say to my ladies and my the men that come to me, is that, just do what you can, right? And filter out what you can't. And also, like, with information, I think we've talked about a lot tonight. And I say to everybody, use what you find useful and filter out all the other noises. The families having their say, the doctors having their say, and just feel what feels natural to you. So taking the time to be mindful, and just be with yourself. And yeah, self-care comes in there.
I like that, and I think self-care is self-dependent. It's what works for each person. So, what would you say, or how would you say a person who has a loved one who's going through their fertility journey can be of support? Because, like you mentioned, for someone in the journey, they can separate themselves from, the world. But now I am that person's loved one, and I want to be there for them, but I'm not sure how to do that. So how would you advise a loved one?
Oh, that one's difficult. I don't think you prepped me for that one, but I'm going to
I
try.
know.
I'm going to try
It's
my
not on the
best.
script.
It's not on script. Oh, I love you so much for that. You're keeping my mind active so late at night. No, so I think it's difficult. And I think what you need to do is ask the person. Don't be scared to ask the person what they need. Sometimes I needed a hug from my mom. Sometimes I needed somebody to run me a warm bath. Sometimes, there were times where you sit in the bath and you just cry, and just having somebody sit next to the bath with you, and not saying anything. There were times when, like, my mom would say, okay, I don't know what you need. What do you need? So I'm like, I just need to vent. I don't need you to respond. But it's just, I think, getting in touch with where you are helps you communicate what you need to others, right? And sometimes, your family doesn't agree. There might be religious beliefs that go against IVF. And so it's about finding a support system. Like I said right at the beginning, it takes a village to go through IVF. So finding a clinic that you resonate with. I didn't want to be, one patient calls it a sausage factory. I don't want to be part of a sausage factory where I see different doctors every day. I wanted to see my doctor. So I chose a fertility clinic where I see the same doctor every single day and my team doesn't change. I'm fortunate my embryologist lets me visit my eggs. And sometimes I actually go and sit and he will say, do you need a cup of coffee? I'm like, no, I'm just here to sit today. So he's like, oh, okay, are we visiting the eggs again? I'm like, yes, that's what we're doing, So it's seeking the support, be that professional. Therapy is not for everybody. I know I'm a psychologist and I'm supposed to put it out there, but for some people it's doing acupuncture. For some people it's yoga. You get wonderful yoga practices and poses and things that you can do to help you bond with your body and also to help you stimulate your reproductive system. So it need not be therapy. It can be exercise. It can be going into your spirituality, looking for support groups if you have. But open communication is usually the best. Having open conversations with, if you're fortunate enough to find a support group or couples that are willing to share honestly with you. Self-care is very important. So managing your stress and expressing yourself. There's some times where you have these outbursts and you can't remember, you're injecting hormones into your body. You don't know what they're going to do. And educating yourself, making informed decisions. So trying as far as possible to take control over your journey helps you. So for me, it was getting a book, something tangible that I can read. And so the book that I'd recommend to everybody, I think every woman should read it and every man should read it. It's called It Starts with the Egg.
Okay, bye.
Oh gosh, I don't have it with me, but it starts with the egg.
With the egg.
I think it's the Dr. Fett or Fett, F-E-T-T. And she writes it so beautifully. So it's scientifically written, but also it's an easy read for both men and women. And what I found, what helped, me and my partner, is that we read it together. So I read it and he read it, and we spoke about what resonated and how it made sense, and that sort of brought us together, because then we could say, okay, what do we need to do to help each other in this process? And also, we call it our debriefing session after we go see the fertility specialist. You go home and you have all this information and it makes total sense in the session, and you go home and you're like, what was that? It feels like a bus just ran over you. And so we sit and we try and make sense of it. And then we actually decide, okay, what are we going to do? What feels comfortable and what doesn't feel comfortable, and what can we manage financially and what can't we? And that just helps you take control over the infertility process, because there's people prodding and poking you all the time, and it's a very invasive process, because it feels like you don't have control over your body. So, and advocating for yourself and advocating within the community is a way to cope and also bring about positive change. And that also helps you feel more in control of your journeys if you talk about it and share it.
Yeah. Do you think that how do I ask this? Okay, I'm asking this because I'm asking you, my psychologist that doesn't want to be my psychologist. Do you think that this can lead to people separating or breaking up or divorcing, or has this led to that in the past?
Oh, absolutely. I don't know if I'm allowed to say this, but I think we had a few breakups in between the process. You know, I'm sorry if anybody's listening,
Yes.
and if that was an overshare, but it's a really tough on couples,
Mm,
because
mm,
again, like you might blame one, you might blame each other, and it's so difficult. You know, I think it's so hard for men. It's hard for women, but it's hard for men in a different way. In that, so we focus on women and
mm,
the fertility. So the women go through this intensive treatment, and there's so much focus on them. And then they're like, oh, everything's fine now with a woman. Now we need to bring the man in. And now he's lost out on the journey, you know. And so
mm,
men come to me and they say they just feel like they're just providing financially, or they're just sperm donors. And that's not how it should be in my mind. It should be
mm,
something that you guys do together. So for me, I always say, to the woman, like, think of ways of how you can do this together as a couple, because so that you don't feel so isolated and alone, and
mm,
that your partner or your husband doesn't feel like they're just a sperm donor. And so, like with us, we read a book together, we go to our consultations together. I mean, he even went as far as like getting all the information from the embryologist, and trying to understand the science around it.
mm.
They have a fertility show once a year around this time as well, where, you know, they've got talks around infertility, and a lot of exhibitions from different fertility clinics, so that you can get a good feel. I say to all my patients that walk through my door, um, I may not be the therapist for you. I'm not everybody's cup of tea. You need to shop for your therapist like you shop for your shoes. I hope you're shopping for shoes that are comfortable, and that work
Mm,
for you. And that sometimes means that we need to go to more than one fertility clinic. It means that you might need to go to more than one, um, yeah, doctor. And I say, if you're over the age of 30, go immediately to a fertility specialist. You know, don't go through a gynae and then go to a fertility specialist. It is likely that you're going to need a fertility specialist. So getting your support network, that's sometimes not just your family. It can be people outside of your family, is very important.
mm. Sure. You mentioned shopping around, and in my head, I was like, oh, more money, because now I'm jumping from therapist to doctor to doctor. Yeah.
But yeah, so that's what we think, right? But we
Yes.
have these online platforms, right? So go, when I mean shopping, I mean like go on to, like, if you look shopping for a therapist, go on to Psychology Today. All the therapists in South Africa, their profiles are there, or
Mm,
Therapy Route, and see what feels right for you.
mm,
Talk to people who have gone through different fertility journeys. And that's why I say we really do need to talk about fertility more, so that, what do you call it, we can share our experiences to help others and ourselves make an important decision.
I think we should start a support group. But story for another day. I am going to end it here. You mentioned that maybe we should do a series. I won't ask you here. I'll ask you outside of this platform if you think we should have a part two, because I think there was a lot that we didn't cover. But I like how we've had this conversation. I think I'm going to ask you one last question, and then we can end it there. Where can people find resources to read more about this? Because, like I had, there was a question where I had asked about the treatment options that are available. I don't want to go into it because I think it's more useful to give people a source, and then people can go and read for themselves. Either it's reading, watching videos. By the way, before you answer, I found the book. It's Rebecca Fit, right?
Fit.
Yeah, so maybe that's one resource, but where else can people get information?
So fertility clinics, is a good way to find resources. Um, you can also go to SASREG, SASEG, SASREG,
Okay.
their website, and you'll have all the accredited facilities there. And then you can see, okay, in Sandton area, we've got Hope Clinic, we've got MedFem, we've got Vitalab, so and we've got Sandton Fertility Clinic. So then you can go onto those websites and have a look at, and go onto LinkedIn, go onto Insta. Everybody's creating content on there, and then you get a good feel for the practice. And like I said, just have conversations with people. But yeah, I think it's about equipping yourself. And that's really important, is you taking control over this journey.
Okay. Okay, cool. One last question. Are you available for people to reach out and ask questions? Either people who are already in the process, who have been shopping for therapists and feel like I connect with this lady and I think she'll get me. Are you available? Because if you are, then I can share your email address when I share this live.
I'm always available when it comes to something so sensitive, and when it's sometimes a taboo topic to talk about. And so, yes, I am available to help in whatever way. If that is just, guiding, getting a feel of you, and then trying to guide you to the different resources. Because as I say, your treatment plan is very individualistic and specific to the couple. And yeah, I'm happy to share thoughts, feelings, ideas around fertility.
Okay. Thank you so much. This was very insightful, a bit heavy here and there, but I think you've made it, like I mentioned before, you share information so digestible and palatable. You didn't complicate it all. And I'm so grateful that we were able to have this conversation, especially because it is World Infertility Awareness Month. I hope that we can have another conversation where we unpack, maybe to focus on one thing. Are you trying to have a baby? Or maybe we call it starts with an egg and then we unpack that. But thank you so much, Tammy. Have a beautiful evening and I will speak to you soon.
Thank you so much, everybody, for joining. Thanks,
Thank
Quizzy. Take care.
you. You
Bye.
too. Bye. Bye.